Health workers received the J&J jabs in the first half of this year are now eligible for the booster jabs. Just to remind you that J&J, you only got one jab, unlike the Pfizer, but now it's the booster jab for J&J. But it seems not everyone is happy, as some healthcare workers are quoted by the media saying they're being used as guinea pigs. Is this true? South African Medical Council President Dr. Glenda Gray joining us this morning. Dr. Gray, good morning. What do you make of the quotations of some healthcare workers saying they're guinea pigs?
So the single-dose J&J jab was produced as an emergency intervention, and this intervention saved many lives and reduced hospitalization amongst our healthcare workers. Healthcare workers got a vaccine ahead of everybody else, and by doing this, we were able to protect them during the third wave. New data shows that boosting the first dose of J&J with another J&J makes the vaccine as effective as Pfizer. So we have data on safety, we have data on immunogenicity, the immune response, and we have data on effectiveness, which means that it is our job to provide this to the healthcare workers ahead of the next wave. And so the healthcare workers are very fortunate that we're able to access emergency use of this boost so that they can be protected against the next wave that's going to happen over the summer months.
And Dr. Gray, and I'm sure we're going to have this debate going forward as well. Earlier in the year, you and I spoke on many occasions talking about vaccination apathy, anti-vaxxers, all those various terms. Now it seems we have health worker vaccination apathy. To try and say that slowly and carefully. So how do we now try and get healthcare workers who, A, understand the implications of COVID-19 better than anybody else, I would imagine, but B, also have the education medically to make this choice themselves? What do you do if a healthcare worker doesn't want to take it? What are we telling them this morning?
Well, every healthcare worker has a choice. They have a choice to take the jab that we know is safe and effective, or they have a choice to wait for another option once we have data on that other option, or they have a choice to not take an additional vaccine. But we do know that these vaccines do wane. We know in the US and in other parts of the world, healthcare workers are taking a third dose of the mRNA vaccine. And so we do know, and we've discussed this many times, that people will need booster doses eventually. And so the nice thing about the J&J jab is that we've had to wait only between 6 and 9 months. We've been able to space the vaccine between 6 and 9 months to get good durability. And this we have not seen with the Pfizer dose that needed a third dose very soon after the second dose. So it's important to look at durability. Vaccines do work differently. And at this point in time, we can say that no one vaccine regimen, a two-dose regimen, is better than another one. And so I think we can all agree that these vaccines work, particularly if they're given as 2 doses, and that we should not be comparing one vaccine against the other because we have evidence at a global level that all vaccines work.
Someone tweeting me, Dr. Gray, at Gareth Edwards SA, please ask Dr. Gray, I'm not a healthcare worker, but I received a single dose J&J. When do I go for my booster shot? I'm not in the healthcare sector.
So that's a good question. So we will use this period of time to vaccinate the healthcare workers with the second J&J to evaluate, first of all, how to roll it out, and then to evaluate the field effectiveness of this. And once we have all this information, we're very well aware that there are teachers, policemen that got their vaccine in July this year, and so we do have time to evaluate when is the right time to give the people who got the single J&J jab a second dose. So there is some time, and we know that the vaccine is durable, even out to 9 months, and so we need to watch this and give advice to the government based on our experience with the healthcare workers that we are about to embark on this jab with them. And so the healthcare workers will provide us very important information that will help inform the national rollout going forward.
Dr. Gray, I'm sure you wouldn't mind me asking this question in the last 30 seconds I have with you. Just on the COVID numbers very quickly, so there were some concerns after elections. It was going to be some kind of super spreader event. We are seeing a slight uptick in the numbers. Professionals like you, are you getting concerned about this increase as we head to what was this expected fourth wave? Are we worried?
Of course, we should always be worried, and also we're worried because not enough people have had their first dose of a vaccine. And the only way we can control the next wave is to get people vaccinated, and that'll help us be able to control it. So we have to watch it out. We have to watch very carefully how the virus is evolving in South Africa. It's tourist season now. People are coming from all over the world. Hopefully they've got their vaccine, and hopefully we're checking that they've got their vaccine. And so that we also need to see that travelers coming into our country aren't coming in with COVID or without being vaccinated. We are looking at wastewater surveillance at airports to make sure that we can try and keep an idea of whether there's any COVID being detected at the airports in South Africa.
Well, I appreciate your time, as always, Dr. Glenda Gray, President and CEO of South African Medical Research Council. So just to clarify on the terms of, and I quote, guinea pigs, Dr. Gray very clear on this, that there is research behind this booster shot for J&J, and no healthcare worker is being forced to take the vaccination booster shot. So if there was any confusion about that. So